Welcome to this Clear Fact. Now, today we have a very interesting question from Dr. Wang. Question is, what happens if I have some IPR planned and I don't do it? My name is Stefan Reinhardt, Director of Education for the Clear Institute, and
my name is Michaela Sehnert. I'm a general dentist in Germany.
And we answer the question right after this.
If you like these videos, subscribe to this channel
and don't forget to click on the bell to be noticed every time we upload a new video on this channel. And also
give us the thumbs up.
Michaela.
Stefan.
Very interesting question today about IPR. You know, there's a lot of passion in IPR. When you talk about IPR, dentists are, some dentists are really against IPR, blah, 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 and some others are all for IPR. Where do you stand? Do you have any problem with IPR, Michaela?
No, in fact, I don't. If I have a good planning, and I mean, we're going to talk about this today, I'm not afraid of IPR. In fact, sometimes I really prefer to do IPR to, get some space.
Yeah, the important thing to know about IPR, I mean, it's okay if you're not comfortable doing it, don't do it, but you have to find another way to create some space. The goal of IPR is to create some space when you don't have enough space. There are ways to do IPR, and we're backed up by science. I mean, if you look at scientific literature on IPR, there's no problem. You're not doing any damages to the teeth, to the enamel, whatever. So the important thing to know is that we do no harm to the patient when we are doing IPR. Again, yes, we're backed up by science, but there can be some problems if we do not respect what is in the treatment planning. Now, one thing to make really clear here is that you are controlling your IPR. Even though the software tells you where to do the IPR, you can all change that. You have to be in control. You're the one who decides where you want to do the IPR and how much you want to remove. So let's say we take a case and I have some IPR plan, like here. Now, Michaela, are you comfortable with the IPR you're seeing here?
I mean, it would depends on a lot of things, but what I'm seeing now, from not knowing the patient, I'm comfortable doing that.
Okay. Can you tell us about what we're seeing here? So what are these little diamonds there with a number inside?
Yeah, first of all, the diamonds, they can be colored in different shapes. This is what we will show you after. And we have, numbers in those little diamonds. And it says here 0.5 between the premolars, and then from 3 to 3 we have 0.4. So it means we do have to remove at one point, right, those 0.5 millimeters, 0.4 millimeters in that approximal space. So this is what we see here.
Yeah, that's it. And if you want to know when, there are different ways, but you can just go with your cursor with the mouse over the little diamond, and you see it tells you we need to do 0.5 IPR before aligner 11, between T35 and 34. I mean, this is the FDI numeral that we're using, but it tells you when you have to do it. And the question is, what happens if you don't do it? So look at the others here. It's before 11, before aligner 31, before aligner 31, 31, 31, 31, 11, and 11. So what happens if you're treating this patient and you just see the IPR, but you decide, I don't do it with me, Michaela. No, at the same time. We should never do that at the same time. So what will happen? What will happen if we don't do the IPR and we just continue with the treatment?
Well, it's a feature like other features, like attachment or anything. It's really there because we need it. So if at one point, let's say, you removed only 0.2 millimeters or nothing from the 0.5, we will have a problem at yeah, a several number of aligner. We will see that maybe the aligner doesn't fit anymore, or the patient is going to tell us it's a bumping, or we see a little space between the tooth and the aligners, and that's going to tell us, well, the tooth did not move and that planned direction, you know, what we were seeing on the ClinCheck. And it's sometimes, or it's a lot of times, because even when doctors start with Invisalign or with clear aligners, and a lot of times they're really careful in removing in between those teeth, you know, creating that space. And a lot of times it really, when it comes to the end of the treatment, it is one reason why maybe it did not work the same way we planned it.
Yeah,
So
because weird things can happen. Yeah, now you have to think of what are you doing. In fact, when you're doing IPR, is again you're creating space. So you need space to be able to align the teeth. If we look at the teeth here, there's a lot of space missing. So we have to find a way to create space, and we decided to do IPR. So if I don't do the IPR, I'm not creating the space I need. Look at here. We have 1, 2, 3, 4, 5, 6, 7, 7 times 0.4.
yeah.
2.8 millimeters plus another. So it's almost 4 millimeters of space that I need to create. If I don't do it, and my patient still continues to change the aligners, it's going to create pressure on the teeth. Now, this pressure, a lot of times what we see, that the reaction of the teeth to that pressure is either they will stay crooked or they will align, but there may be some intrusion. You're making a pressure on the arch, and the pressure you're making on the arch can cause intrusion. And you see intrusion sometimes on the premolars, sometimes it could be on the incisors, and you wonder, why do I have intrusion? I never asked for intrusion. There's no intrusion plan in my ClinCheck, but you see intrusion, and it's because you didn't do the IPR you were supposed to. So this is what's happening. Now, you were talking about the colors.
Yes, this is, I mean, like you did it is one way to just prove at which point, or I really have to do the IPR, but the ClinCheck also shows you, like when the patient are coming to the checkup appointments in my clinic, the ClinCheck is always, you know, in the back. We always, of course, we have those little sheets, what's coming in the box, but we're a digital clinic, so we prefer to have the ClinCheck. And let's say my Invisalign coordinator, she is handing out the next set of aligner, and the appointments are always, you know, of course, timed at those points where we maybe need to do IPR. And to make sure at which space we do have to do it, you know, we need to do it, we always open the ClinCheck. So we can check here on your ClinCheck what you have.
Yep.
Show us.
Well, the first thing is we see the white color. So what does white color? We have these white diamonds.
Yes.
What does white mean?
IPR is planned but not done yet.
Exactly. So if we go, remember we had some at 11, right?
Yes.
We had some at 11, some at 31. So if I go to aligner number 11, you will see.
So at this point, it has to be done, right? Because, so you could say aligner
This
11.
is what the yellow means.
That's it. But and now you could even tell yourself, if 0.5 for me is maybe too much to do at the first appointment, because sometimes you have really crooked teeth, like you see in the anterior teeth here. If you tell yourself, I'm not comfortable to do 0.4 at the first appointment, maybe you use at the beginning some diamond stripes to really make sure that you keep the shape of the teeth, whatever. You could say, I do 0.2 at the first time, and 0.2 at aligner number 5 or whatever, but latest, you need to have it done at aligner number 11 here. This is what the yellow says. Here is the latest point to do it.
And this is where if you don't do it, you can start seeing some problems. So now let's go at number 12. And again, the one who are yellow, they change color and they are gray now. Why?
Because it tells us here at that point, it's already done. And if you did not do it, like Stefan said, it could cause, at one point, it will cause some trouble, right?
That's it. Now let's go to 31.
But you know what's more? Yeah, that's it. Now at 31, we see those IPR, what was planned in the anterior teeth, needs to be done latest at that aligner. And it's really nice what you're showing here, because it's your case and you decided, at what point you feel comfortable to do it. Because what Align is a lot of times doing, they put all the IPR we need at the first aligner. And of course, they're doing that because they want us to have less numbers on aligners. And okay, we get that. And of course, we want our patient to finish really the fast we can.
Yeah.
But on the other side, we or I, as a dentist, I need to make sure that I really can do the IPR, that I really see what I'm doing. And like what Stefan is showing here, he uses the first aligners maybe on the anterior teeth. Go back, Stefan, to the first aligner and just see what he's doing. He's first of all, he's a little bit expanding, right? That the teeth maybe come to a better position, a better a position where he can really see better what he's doing in between. And then he does the IPR. And
But
yeah.
you can you just imagine me trying to do IPR here or in
You
between these teeth?
trying.
I have no access. So,
Yes.
and this is where when I was saying that you have control over this, and it's important that you take control because again, the software is incredible. It's there to help, but it's not there to decide at your place. And the like you were saying, there's different goals when you're doing the IPR. You want to have this access, like you said. But my goal also is that if I show you this case at the end, Michaela, I don't want you to be able to tell me, oh, you did some IPR there and there and there. I don't want you to be able to see it. I want to respect the anatomy of the teeth. And because of that, I need to have good access. And this is why when I saw and I planned my case, I just looked over the ClinCheck and I saw that, you know, at number 31, now I have a pretty good access to do my IPR, respect the tooth anatomy, and make sure that it doesn't show. I don't want a straight line like this between two teeth. This thing doesn't have to show at the end.
And it's not only because of your work. I mean, this is what, I mean, we want to work minimal on the best minimal invasive, even on treatments like that. And this is why it's even for the patient, you know, it's even more comfortable if the teeth are more straight, or if you say, okay, I do my IPR step by step, it is more comfortable for the patient on the chair. I mean,
Yeah, of course, much more easier to do.
yes, that's it. So I think we will talk in another clear fact maybe about with what we're doing the IPR, and sometimes where
Or you can
maybe-
go and you can get educated on that too.
That's true, because
And
IPR.
I wonder where.
Me too. So IPR is a big topic, but today what was really important to know, if those numbers are shown in your ClinCheck, you really need to respect that. And Stefan, sometimes the dentists have a trouble. How do they know that they really did the amount of IPR? I think this is really important here to say, because sometimes they have the feeling they really did a lot, and at the end it maybe shows it was not enough, like planned 0.5. So what are you using? How you're doing that?
Well, I've been doing it for so many years now that I use this.
That's
But
it.
when I started, I had some little gauges that you can take that you can measure how much you remove between the teeth. Now, one important thing too that I do all the time, I always remove a little bit less than what they ask for.
Yes, that's true.
Do you know why?
I know why. Because
Do you know why? If you want to know, be there next week because this is what we're going to talk about.
yes, perfect.
This is everything well for you today. My name is Stefan Reinhardt, Director of Education Program for the Clear Institute, and
My name is Michaela Sehnert. I'm a general dentist in Germany.
have fun making the move. If you stayed up to here, it's because you like this video. Now, if you like this video and you're not subscribed yet, what are you waiting for?
And don't forget to click on the little bell that you're going to be notified every time we upload a new video, and give us the thumbs up. It makes us really happy.
And if you're interested in clear aligners, check out all the videos we have available for you on this channel.